All right, in this video, I'm going to show you guys how to perform the simple horizontal mattress. I particularly picked this technique because I've grown to love this the suture technique. I've noticed patients have healed beautifully. So normally when I perform this technique, it's normally in moderate to high tensioned areas, such as the trunk and extremities. And you may notice that I'm going to perform this technique slightly different towards the end, and I'll show you how I perform it slightly different and the reasons why. So what I like about this technique is it doesn't create that horizontal track mark across the wound like you would normally see in the simple interrupted technique and the running suture technique. And also I love how it allows you to take broader anchoring bites because you enter and exit the skin technically at 4 different points across the wound, which gives better support once you complete the technique, and then also helps distribute the tension along the length of the wound once you finish it. And just to remind you guys, normally when we perform this technique, normally we have the right amount of deep sutures placed in here. If you do not have the right amount of deep sutures placed in here, this technique, especially the way I perform it, will not be successful. So assuming we have the right amount of deep sutures in here, we're going to start demonstrating. So I'm going to demonstrate it a couple times. The first demonstration is just going to be real quick. Most of you guys who are viewing this, if you are in dermatology, you are probably pretty familiar with how to perform this technique. But the first demonstration, what we're going to do is we're going to perform it real quick like how I am right now. And the second demonstration, we're just going to slow it down a little bit so that way you can understand what I'm doing and why I'm doing it, and I'm hopefully explaining the rationale of what's behind each step. And the third demonstration, I'm going to show you how not to perform it. And then the fourth demonstration, I'm going to show you something called the buffer technique that I've created that I've noticed have helped patients heal beautifully. All right, so that's the first demonstration. That's how you essentially perform it straight through. And then what I'm going to do with the second demonstration is I'm going to show you and explain to you how I'm performing each step. So here's your incised wound edge. You want to be perpendicular to the skin, a couple millimeters away from the incised wound edge. You want to go straight down. If you want to take a larger bite towards the bottom, that's going to create more of a pronounced eversion. But because we don't have much tension on the wound, we're just going to go straight down perpendicular. We're going to go across the wound as we follow the curvature of the needle, and we're going to go straight up perpendicularly towards the skin, and you're going to pull that needle through with your needle driver. And as you exit, you want to be mindful that you are the same distance. You are the same distance from the incised wound edge as you are on the other side. You're essentially mirroring the other side. So where you exited on the contralateral side, you are going to be the same distance from the incised wound edge, move a couple millimeters down, enter the needle perpendicular, straight down, and you're going to go across the wound like you did before, follow the curvature of your needle, and as you pass that needle through, you're going to try to be 90 degrees towards the skin, towards the epidermis, and then grab that needle and pull the suture through. So you can see how we're mirroring both sides. So this is the important part of which you want to be mindful of, and what I've seen a little bit different in other videos. So how you cinch your knots down and how you perform your instrument tight is going to be so important on how successful the suture is going to be. So your first throw is you are going to ensure that you are going to lay that suture just gently across the skin, and you're not going to cinch it down. Do not cinch it down. You want it to be nice and loose, so that way you can allow the skin to breathe, okay? You want to leave room because you are going to expect post-operative edema and swelling. With your second knot, you just make sure that you're throwing your knots so that way you're securing the suture, but also you're not over-constricting that skin because you are going to allow it to breathe. So that is essentially step by step how we perform it. Now for the third example is we are going to perform it in a way that I don't want you to perform it, right? So you want to leave a little bit of room between skin and suture here. This is what you want to do, leave room between skin and suture here, so that way when it swells, it gives the wound a chance to breathe. An example of not allowing the wound to breathe is going to be in this demonstration right here. So we're going to perform the same couple steps the same. We're going to backhand it. Try to exit and enter the same distance from the incised wound edge. Again, we're assuming that there's deeps in this presentation. Obviously, there's no deeps placed in here, but in real life, you will have adequate amount of deeps in here. So this is what I don't want you to do, is cinch down your suture too tight. What happens is when you cinch down this suture too tight, this will definitely cause overstrangulation. It'll impede that blood flow to the wound edges, and the patient will necrose. So that's why I've heard some people say that they don't like performing this technique because of that potential risk. But if you perform it in a way that I previously discussed in the second demonstration, where you're leaving a little bit of room, then you won't typically have that issue. It looks beautiful right now, but again, sutures in this area typically stay in for about 2 weeks because we're working on the trunk and extremities. So imagine how much swelling and edema will happen. And then what happens is the skin will end up growing over this knot. Patients will have a lot of erythema. Patients will have a lot of unnecessary edema and potential track marks. MAs will hate you for this too, because once they take the sutures out, or when they attempt to take the sutures out, they just have a difficult time because this knot ends up getting buried. So the fourth demonstration, this is the buffer technique that I've recently discovered. So what happens is you perform the technique like usual. And towards the end, when you perform your instrument tie, what we're gonna do is we're gonna leave a little buffer between your first and second throw. And I'll show you what that looks like in a second. So here's your first throw. Again, gently just place it on top of the skin. Don't over tighten it. So that's your first throw. The second throw, you're gonna leave a little bit of a buffer. See how it creates a little circle like that? And I'll show you what happens once we're finished. And we secure it with 2 tight knots after, so that way it doesn't unravel. So that is the buffer technique, and you can see how it leaves a little bit of a circle and a buffer. So what happens is, as the patient leaves and experiences post-op edema, which will definitely happen, especially on trunk and legs, is as the patient's skin swells, you know, instead of it being overly constricting, it allows the suture to slide up, just like so, and gives it room to swell without strangulating that skin. And you have those 2 sutures behind it to secure it so it doesn't unravel. So that is called the buffer technique. So that is the simple horizontal mattress technique and how I recommend to perform it, and things to be mindful of when you're performing it. I think you will notice a huge difference in your patients like I have, and I can't wait for you to start practicing it.